Hello, I'm going to talk today about innovations in psychiatry again. In the last couple of weeks, it was really a surge of very important publications, and I'm going to comment on that and why it matters. The first choice in psychiatry, if somebody is coming with symptoms of depression, it is not so hard to diagnose that according to DSM-5 and other questionnaires that current clinical practice is using. But the thing is that there is a problem with therapies of the first choice. The first choice therapy is medication and also psychotherapy or a combination. But the problem is this. Since 2008 and 2017, when first publications started emerging, we already know that the effect size of effectivity of antidepressant drugs is pretty low. For example, Ioannidis, one of my scientific heroes, who showed actually that unreporting effect sizes is resulting in majority of published scientific research, has very low impact in clinical practice and elsewhere. He actually grab another important task, namely effectivity of antidepressants. And the first important publication coming by John Ioannidis was published in 2008, showing that overall effectivity, clinical effectivity of antidepressant drugs use, which are the first choice of every psychiatrist treating depressed patients, is very low. After that, in 2017, it surfaced Actually, it was published as a result of a large collaborative study, STAR-D, that effectivity of treatment as usual, namely combination of antidepressants and psychotherapy, or individually, is pretty low, between 11% and 27%. So I wonder, if you break a leg or if you're seriously hurt and you go to any hospital emergency and they tell you that, oh, we are going to do this, and by the way, this is only 11% effectivity, would you do that at the first place? Probably not. So basically, study showed that in the first year of therapy, only that fraction smaller than 1/3 of the patients who reported, who are diagnosed, and who actually asked the help, which is not majority, are cured by this, or at least their symptoms are lower than before they started treatment, which is quite unsatisfactorily, should I say the least. And then, after those two initial publications, we now have much larger evidence. For example, again from Ioannidis' kitchen, actually from Ioannidis' lab, it comes publication this year, Falk-Leichenring et al., 2022. This is the efficacy of psychotherapies and pharmacotherapies for mental disorders in adults, an umbrella review and meta-analytic evaluation of recent meta-analyses. They basically showed that effect size on large review of other meta-analytic studies is all below 0.4, meaning that effect size of antidepressant use is something like 0.32 coins D, and psychotherapy a little bit higher, 0.36, which is all very modest. To remind you, reporting effect size is actually the most important information on practical usability in clinical use, showing how significant the measured effect is. So in this case, coins D of 0.3 is considered to be small, 0.5 medium, and 0.6 and larger are really large effect sizes. So we are still in the lower positions. Ioannidis actually commented why it might be, but the results are clear. The effectivity of both antidepressant medication and psychotherapy or combination is really low. This is published on 1st February, the Ioannidis study, and on 19 January of 2022 in PLOS Medicine. Another publication which is really seismic effect in this field is by Turner, Cipriani and colleagues, named Selective Publication of Antidepressant Trials and its Influence on Apparent Efficacy, Updated Comparison and Meta-analysis of Newer versus Older Trials. The thing here is that some experts like Dr. Turner and Dr. Cipriani, who used to work with FDA on approval process on certain antidepressant drugs, performed similar comparison to older antidepressants. Older means before 2008, and they published actually the study in 2014, which showed that by cherry picking and not publishing negative results or interpreting negative as positive results of the study, the effectivity of antidepressants was inflated in literature at least 10%. What is the problem here? Once the company who developed certain antidepressant report to FDA, they present certain results, but in publication they inflated a little bit that to justify the marketing of the drug. So both publications that I mentioned are actually telling us that something must be done in changing current practice in psychiatry. We must turn to some other things. So knowing that psychiatry is one of the most reluctant medical disciplines, which is still not relying on objective biomarkers to confirm diagnosis, I hope this will be enough reason strong enough that they let innovations come into psychiatry. Just to mention a few. First of all, there are some other successful treatment aside antidepressants and psychotherapy, namely varying types of non-invasive electromagnetic stimulation of the brain, to mention just few: repetitive transcranial magnetic stimulation, or for example transcranial direct stimulation, or for example we have vagus nerve stimulation, which is also showed in two recent publications, like the one coming from Delacqua 2022, showing that heart rate variability, which is giving you information of cortical effect on heart rhythm, is in connection to clinical symptoms of depression. And also Popa et al. 2022, which is showing why vagus nerve stimulation is effective. Also, we published 2 years ago, more than 2 years ago, the proof why electromagnetic stimulation of the brain are effective in treatment of depression. I will link down below all mentioned publications so you can see yourself. So to summarize, after the flood of evidence is coming out, I think that people who are working in clinical psychiatry or clinical psychologists, all the therapists who are working with depression patients, will consider adding some of already thoroughly examined and proved therapies and the ways how depression is detected and can be forecasted to improve the quality of life of their patients and to arrive at much better and more effective overall treatment. Thank you for listening.